Most people believe that numb, tingling, or swollen feet are just an inevitable part of getting older. They've been told that after 50, foot discomfort is something you just have to live with. But what if I told you that science shows the exact opposite? If you've been feeling burning pain at night, noticing strange changes in your toenails, or seeing wounds on your feet that take forever to heal, it's usually not because your body has stopped working. It's because the internal repair signals in your vascular and nervous system are being actively blocked by a few silent, common mistakes most people never even connect to diabetes. Today, I'm going to share 7 specific warning signs that science proves are among the earliest flags your body sends before a diabetes diagnosis becomes unavoidable. And make sure you stay until the end, because sign number 7 is the most misunderstood factor that even many doctors overlook during a routine checkup. After the age of 50, your body enters a new biological phase. Your cellular repair mechanisms, nerve conduction velocity, and peripheral circulation naturally begin to change their operating manual. These are not failures, they are processes that can be optimized. But they do make your feet uniquely vulnerable to the early damage that diabetes causes, sometimes years before your blood sugar numbers even look alarming. Think of your body like a grand vintage estate. The foundation is absolutely solid, but the plumbing and electrical wiring need different maintenance than they did when the house was new. If you run the same old routine in a 50-year-old system, small blockages in the pipes, your blood vessels, start causing damage all the way out to the farthest corners of the property. And the farthest corners, that's your feet. According to research published in the Lancet Diabetes and Endocrinology, peripheral neuropathy, the nerve damage that shows up first in the feet, affects up to 50% of people with type 2 diabetes, and in many cases, the foot symptoms appear months or even years before the formal diagnosis. Catching these 7 signs early can significantly improve your outcome if acted on correctly. Sign number 1 is persistent tingling or numbness. Most people assume a pins and needles feeling in their feet is just poor circulation from sitting too long. They dismiss it, shift position, and move on. But when this feeling returns consistently, especially at night, they are actually missing a critical biological alarm. Inside your body, persistently high blood glucose causes a process called glycation, where sugar molecules attach to nerve fibers and damage the protective myelin sheath around them. When this sheath deteriorates, your nerve signals become erratic, producing that tingling, buzzing, or numb sensation. This is early diabetic peripheral neuropathy in action. The fix involves managing blood sugar at the cellular level, not just with medication, but through anti-inflammatory eating patterns that reduce glycation directly. Foods rich in alpha-lipoic acid, like spinach and broccoli, have shown in clinical studies to support nerve repair. Imagine your nerve fibers finally getting the clear signal they've been waiting for, like a static-filled phone call that suddenly goes crystal clear. You'll notice warmth returning to your feet and fewer nighttime disruptions within weeks of consistent change. Sign number 2 is slow healing cuts or sores. Many people believe a wound that takes a long time to heal is simply dry skin or a result of aging. They apply lotion and wait, but they are actually watching the early stages of diabetic wound impairment unfold on their own skin. Elevated glucose impairs the function of white blood cells, which are the body's primary repair crew. It also thickens the walls of small blood vessels, restricting the delivery of oxygen and nutrients to the wound site. Without that supply chain, healing stalls dramatically. Science shows that zinc-rich foods, pumpkin seeds, legumes, lean meats, directly support wound-healing enzyme production. Combined with vitamin C to rebuild collagen, you are essentially resupplying the repair crew with the tools they need to work. Picture your skin cells finally receiving the nutrients they've been starved of, like a construction site that finally gets its materials delivered. You'll notice that even minor scrapes start closing faster and without the prolonged inflammation you've grown used to. Sign number 3 is burning pain in the feet at night. Nighttime foot burning is routinely blamed on tired legs or poor footwear. People buy new shoes, elevate their feet, and never address what's actually happening at a deeper biological level. When nerve fibers are damaged by glucose, they begin firing erratically, sending pain signals to the brain when there is no actual injury. At night, without the distraction of daily activity, these misfiring nerves become much more noticeable. This is called allodynia, sensation without cause. Magnesium brisonate combined with consistent sleep hygiene has been shown in multiple studies to reduce nerve excitability. This is not a painkiller masking the symptom, it is directly supporting the electrical stability of your nerve cells. Think of your nervous system like an overloaded electrical grid, finally getting a circuit breaker reset. Restful sleep, which may have felt impossible, begins to return as the nerve noise quiets. Sign number 4 is changes in skin color or temperature. Cold feet, bluish or reddish skin tone, or patches of unusually pale skin are often dismissed as bad circulation. While that phrase is technically accurate, most people don't understand what's actually causing that circulation to fail. Diabetes accelerates atherosclerosis, the hardening and narrowing of arteries, even in the small vessels that feed your feet. When these microvessels become stiff and narrow, blood flow to the extremities is dramatically reduced, resulting in temperature changes and visible color shifts. Omega-3 fatty acids have clinically demonstrated the ability to reduce arterial inflammation and improve endothelial function, the health of your vessel walls. Consistent walking, even 20 minutes daily, also activates the body's natural vasodilation response. Imagine your blood vessels slowly widening again, like pipes having years of buildup gently cleared away. Warmth returns to your feet, your skin tone stabilizes, and that cold, disconnected feeling in your toes begins to fade. Sign number 5 is thickened or discolored toenails. Yellow, thick, or crumbling toenails are almost universally blamed on a simple fungal infection, and while fungus may be present, the deeper question is why someone with diabetes is disproportionately vulnerable to it in the first place. Elevated blood sugar creates an environment in which fungus thrives. Glucose literally feeds the organism. Simultaneously, reduced immune response in the extremities means the body cannot fight the infection with normal efficiency, allowing it to take hold and deepen rapidly. Beyond antifungal treatment, the underlying solution is restoring the immune microenvironment of the feet through blood sugar management and probiotic-rich foods that rebalance systemic immune response. Picture your nails gradually returning to a healthy, clear appearance, not because you've covered up the problem, but because you've removed the environment the fungus needed to survive. That's a body-wide shift, not just a cosmetic one. Sign number 6 is swelling that doesn't go down overnight. Most people assume swollen feet are the result of standing or sitting too long, a purely mechanical problem. But when the swelling is still present in the morning after a full night of rest, something more systemic is at work. Diabetic nephropathy, early kidney damage from sustained glucose, reduces the kidney's ability to filter fluid efficiently. The result is fluid retention that pools in the lower extremities. This is the body's early signal that its filtration system is under stress. Reducing dietary sodium and processed sugars simultaneously gives the kidneys immediate relief. Dandelion leaf, shown in early clinical research to have natural diuretic properties, can support kidney filtration without the side effects of pharmaceutical diuretics. Imagine your kidneys finally exhaling, no longer overwhelmed, processing fluid at a healthy rate. You wake up and your shoes fit again. That puffiness that became your new normal? Gone. And finally, sign number 7, and this is the one almost nobody talks about, including in many doctors' offices, is the loss of hair on the feet and toes. People simply don't notice that the fine hair on the tops of their feet has gradually disappeared. They've never been told to look for it. Hair follicles in the feet require healthy blood flow to survive. When peripheral vascular disease, the same vascular damage diabetes accelerates, chokes off microcirculation, the follicles starve, and the hair stops growing entirely. The absence of hair on the feet is one of the earliest, most reliable signs of peripheral vascular compromise, and it is almost never discussed. Restoring vascular health requires the most consistent, holistic approach of all the points covered today, combining anti-inflammatory nutrition, blood sugar stabilization, regular movement to stimulate blood flow, and where needed, medical evaluation for artery health. It's not about the hair coming back. It's about what restoring that circulation means for every other function in your feet and your entire body. When blood flows freely again to the farthest corners of your body, everything downstream begins to heal. You see, protecting your feet from diabetes isn't about one single habit. It's about how blood sugar stability works with anti-inflammatory nutrition to create a repair environment. When circulation improves, nerve health follows. When nerve health improves, your immune response in the extremities strengthens. When these elements align, your body stops being its own enemy and starts rebuilding from the ground up. It's not about being perfect for one day. It's about giving your body the right information consistently. Food is a signal. Movement is a signal. Sleep is a signal. Your feet are receiving every single one of those signals every day, and they will tell you honestly whether those signals are helping or hurting. Finally, we reach the most critical part, and it's the one that almost no diabetes management plan addresses: the connection between stress hormones and blood sugar. Cortisol, your stress hormone, directly raises blood glucose levels, compounding the very vascular damage we've discussed today. Most plans focus entirely on diet and medication. Almost none of them address the fact that unmanaged chronic stress is actively undoing that work at a hormonal level. Your nervous system and your blood sugar are in constant conversation. If you want to protect your feet and your future, that conversation has to change. Remember this: your body is extraordinarily intelligent. It has been sending you these signals in your feet precisely because it wants you to listen. It wants to heal. It wants to be strong. It just needs you to be the partner it deserves. Someone who pays attention, takes these signs seriously, and takes consistent, science-backed action. I want to hear from you. Which one of these 7 signs surprised you the most? Have you noticed any of these in your own feet or in someone you love? Leave a comment below. I read every single one, and your experiences genuinely shape the content I make next. Your health is built through small daily choices, simple awareness, science-backed support, real repair. Look after those feet. They carry you through everything. I'll see you in the next one.